Hello, I'm Dr. Greg Winteregg. I'm a dentist and a partner at MGE. And for today's tip of the week, I want to talk about the value of a hygienist. The right hygienist can create a very stable hygiene department and help the practice have a solid foundation and expand into the future. The right hygienist is actually an ambassador for the practice. The wrong hygienist can actually destroy the practice and have patients leaving without even saying anything. I've had many clients tell me here at MGE that through certain different circumstances the hygienist has been replaced, and it was only after that hygienist was gone that patients started to say, "Oh, I was thinking about leaving," or "I never did like that hygienist anyway." And here's the truth of it is, most patients aren't going to complain. They don't want to be considered a whiner, they don't want to be considered a troublemaker, and oftentimes you're not going to know. So doctor, then the responsibility is yours to observe what is going on in your hygiene department. There were actually three main components of a great hygienist. First of all, there has to be great clinical quality. They have to be able to do a good job. The second component is patient comfort. They have to be able to do a good job without causing discomfort and pain to the patient. And thirdly, there has to be some chairside manner so the patients at least don't mind coming back to see that hygienist again. And it's real easy to kind of get into a rut and just settle for someone else who's there just so the doctor doesn't have to do cleanings. But it's time to really stand back and take a look at this. When you're hiring a new hygienist, I suggest you have them clean your teeth, have them clean the teeth of the staff, have them in and let them see patients for a day or two, and then I would call the patients and see if the patients were happy. Sometimes the patient isn't even going to see the doctor depending on the circumstances and the laws of the state. So this really needs to be confronted. The hygienist then is the ambassador of the practice. And they're either going to be a great ambassador and help stabilize the practice, or they can be a poor ambassador and destabilize the practice. So I suggest you don't just settle for someone to be in the hygiene department. I suggest you look for someone with good clinical competence, someone who isn't going to hurt the patients, and someone they don't have to be effervescent in their personality, but it has to be someone that patients don't mind coming back to see. You need an ambassador for your practice, and that's going to take some work. That's my tip of the week. If you want more information like this, click on the subscribe button, and if you want to know more about MGE, visit our website.